So we should understand the most important person of a hospital is the patient. Most important part of education institution is a student. So what does a patient want? They want to get well. They want functionality. They want ease. They want to get back to their normal life. So if they come into a hospital, we should have an integrated setup where if there's an emergency, they get the emergency care. If it is not an emergency, don't load them with unnecessary drugs. Other systems can be given the first go. If you cannot help them with that, then go on to further medication. So I think my professor of medicine, Sri Aurobindo sir, used to say 40% of patients who come to the hospital, there is no medically explainable diagnosis. It's medically unexplained symptoms. It is very vague. So they keep on going round and round. So when people come into the hospital, I believe we should have an integrated setup. It doesn't mean same patient has to be seen by all 6 doctors and given 6 types of medications. If they need the Ayurveda, go to the Ayurveda. If they can be treated by Siddha, go to Siddha. If Siddha and homeopathy or Siddha and yoga and naturopathy, look at a system of integration. I am not in favor of mixing the educational component because I believe each system should build on its strength. Ayurveda should bring out the best Ayurvedic physician, homeopathy the best homeopath, yoga and naturopathy the best BMYA should come out. Now after that, once they have the bachelor degree, in the master's level give them the option to switch. So somebody who does MBBS can go on to do MD in homeopathy. Or they can do, have that type. Somebody who has done the homeopathic bachelor can go on to do an MD in general medicine. Find that type of linkage. This idea of mixing it at the foundation, I believe we'll end up with half-baked people. So I am very skeptical of this because I already find, I was a gold medalist in medical studies. At the end of 4.5 years when I went for internship, I didn't know what to do with the patient. I remember crying to my professor of medicine. I said, sir, I have been the best student. I have worked hard. I have done whatever was required, I have done. I don't have the confidence that I can help a single person in my life. And at the end of 4.5 years of hardcore allopathic training. Now, if you say you will get 2 years of allopathy, you will get 2 years of Ayurveda, in between 6 months of this, the person is going to come out not knowing what to do. So I believe the future is strengthen all the systems equally. Today there's a stepmotherly treatment of all the Ayush systems. As I said, first preference is MBBS, uske baad you go through everything and then finally you come to Ayush. What type of people are going into the system? So it should be that at least if not the first level, because people look at financial outcomes, financial guarantees, that is what they look at. It should at least be at the next level that they get it. But I believe integration in education should be in the postgraduate level. Yes, sir, like a specialty, and then offer them opportunities where they can learn more. If I want to know more about homeopathy, give me a 2-year course where I can enhance my understanding, bring in regulations for the mixopathy. Now we don't have that. And allopath cannot prescribe other systems, other system cannot prescribe allopath. So as long as you have a legal provision that prevents it, we are going to have issues. So individuals will do it, but as sir said, unless it comes from the top, and the top man wants it to happen, so it will happen.